with this. I was at the lowest of the low in 2012, to the point I was suicidal. I decided that I had to go to the doctors because I've got a fix-it personality, and I decided to ring on the morning, where you can only get an appointment if you ring at 8:30 in the morning. And I rang the receptionist. She triaged me. I have a bit of an issue with that, but anyway, she triaged me. And she didn't want to give an appointment that day. And I insisted, because I wanted to drive into a wall. On my own, no kids, obviously. And I went to the doctors. They weren't very happy with me. He did the assessment. He said, "You're very depressed. Here's some pills." Mrs. Allatt, it's hardly an emergency appointment, is it? It's not like you're having a heart attack. To which I stormed out of the room. And I think that was a long time ago now, but that, for someone who doesn't go to doctors or hospital unless they're having babies or you're really very ill, because I just want to be busy doing my stuff, you know, and when I need the help, I need the help. So that flexibility and that understanding wasn't really there at the time, I felt. I just have to share that because I think that's the important message. I have talked to the doctors about it since, by the way, my doctors. So I guess what I'm trying to say to you is, what do you think you could do to improve the patient relationships in your surgeries? Because I'm going to go on to some ideas now, which hopefully you'll just take away and think, if I haven't already tried that, maybe we ought to look at that. For example, can we communicate better with our patients? If we communicate better, then we'll have better relationships. How can we do that? I recently went on a coaching course, a doctor one actually, where you're feeding back to the patient. I'm sure you all do that. Let's see. Let me see if I've got this right. Did I miss something? To really drill down to find what the issue is. I don't want to tell you how to suck eggs, but I'm just raising these issues. Is the patient taking alternative medicine? How apt is this, given this morning's story about a 4-year-old that died in A&E with complementary medicine? Because, for example, I take fluoxetine, but I also am very aware that when you've had a stroke, you're very much more at risk of getting Alzheimer's. So me, like a lot of stroke survivors, will take matters into our own hand in absence of pretty much very good research on preventative measures. So, I've taken ginkgo biloba, and I was taking folate and this, that, and the other, and a whole nice big raft of pills. And a friend of mine on Twitter, who's a researcher in Australia, said, "Why? Where's the evidence for this?" And I'm just pumping myself full of this stuff because I think, well, that all helps avert Alzheimer's if you've had a stroke. And obviously, how ginkgo biloba affects fluoxetine is an issue I didn't even think about, how it negates it. So I think that's having some sort of review of what they're doing beyond the prescribed medicines is really important. Keep